Technology has changed my work. PeriGen has definitely changed the way I work. I don't have to run down to medical records if they have a question about someone that has delivered yesterday to look at her tracing. I don't have to scroll through boxes and boxes of fetal strips. I can just pull it up on the computer. So it's definitely improved my workflow.
Before I could call the doctor and they would always question if I was interpreting the strip right. We'd go back and forth about the assessment of the strip, where now it's on the computer screen where they can see it.
It happens often where the nurses have a question about decelerations, or they're worried, should I be worried, should I not? And rather than trying to describe the strip to me, I can pull it up and I can tell, instantaneously if I'm concerned or not.
If we're two nurses back in labor, one nurse can watch two patients while the other one goes to lunch. They can flip-flop and actually be truly watching that monitoring strip, not just, going in every 15 minutes and looking at the strip.
If I have any question, I know I can pull that up. It's like a second set of eyes to tell me if there's accelerations, decelerations, variable decelerations.
Our productivity has improved back in labor and delivery. Our nurses are a lot more efficient as far as with documentation. That being able to document in real time right on the strip is just a huge benefit. It's also, as a director, it's improved my workflow because the nurse can call me. I can log in no matter if I'm at home or at work, in my office. I can log in and see what's going on if she has a question about something that's going on.
I remember one patient saying how great it was because she's like, oh, so you can see what the baby's doing out at the desk? And so that was really encouraging that they knew that we could see everything that was going on basically with the baby at all times.
I'm Kayla, and I had my daughter 2.5 months ago here at Newman Regional Health. This pregnancy, compared to my last one, I was able to relax a little bit better. It was a wonderful experience. So knowing that my baby was monitored the whole time, that everything would be taken care of in a professional way.
All the information flows directly into the patient's medical record, so we don't have to worry about logging into the medical record, so we're not up in two systems, we're not looking from paper. That's what we want to be doing. We want to be helping the patient through labor. We don't want to be charting.
They can be en route to help before the nurse even calls for help if something is coming up. She's maybe actively taking care of a patient and they already know, okay, something's going on, I better go check and see if she needs help back there.
Definitely safety. I feel like our patients' safety levels increased just because everyone can see what's going on, and now I can spend more time hands-on with the patient.
So PeriGen was really easy for me to transition to. Actually, there was no training necessary. They showed me how to log on, and from there, it was very intuitive.
I chose the PeriGen system. It's a great product, mainly because of their customer service.
It's great peace of mind knowing that your baby is monitored the whole time. If anything were to happen, that it would be taken care of ASAP.